Happy Thursday. This is Diane Mikowski, the massage mentor, live with you with Elizabeth. We're going to talk about the Graston Technique today. Again, my name's Diane. I've been doing massage since 1996. I haven't taken a paycheck from another business besides massage since 1996. I love the massage therapy business, and I'm looking forward to get to know all of you. So, Elizabeth.
Hello.
What is up? So good to talk. I got to talk with you a little bit before, we went live, and I just want to say to everyone how amazing you are. It's really cool that you just seem to be a little ahead of the tide with some things. So will you tell us a little bit about yourself?
Yeah, of course. So I'm Elizabeth Cain here in Indianapolis, Indiana, and I have graduated from the massage program in 2013, and since then I spent over 3 years in the chiropractic environment. Then I went to be the campus director of Indiana Massage College and had my own practice on the side. And from then, my own practice grew to the point where I retired my campus director position and I continued my education in advanced cupping, bamboo fusion, and the Graston Technique. Now I am also a clinical advisor and business development for the Graston Technique, and I'm here to bring the awareness of Graston Technique for massage therapy. Exciting new thing and up and coming for massage professions. I'm
Go
sorry.
ahead. I'm sorry.
I'm also
Keep
an
going.
AMTA member, and I am a government relations chairman, a delegate, and a board member for the Indiana chapter.
That is amazing.
Yes.
Thank you so much for all you're doing. It's so
Of
cool.
Course. Happy to do it.
So, okay, let's start off. So the option for massage therapists to become certified in the Graston Technique is fairly new. Can you tell us about that a little bit?
Absolutely. So when I started working in a chiropractic office, one of my chiropractors was certified in the Graston Technique. And I was watching him, and he would adjust me and introduce the instruments to me. And in the back of my mind, I'm learning all this, and I'm thinking, why aren't we certified in this? And I pushed it for over 4 years. And then Graston Technique, they have a new CEO by the name of Dominic Merlina. And kept having multiple breakfasts with him, and I showed him the curriculum of Indiana Massage College. And I explained, massage therapy, we should be doing this. And it was an eye-opener for them. They had no idea of the extensive amount of anatomy, pathology, and physiology, and all the things that we learn in the massage profession. And as soon as they were introduced to the curriculum, they were immediately on board. So effective July 1st of 2017, qualified massage therapists are now able to obtain the Graston Technique.
Woo! Good
So
work.
Yeah.
Thank you so much. Thank you so much. And so now it is actually a approved CEU course. Is that correct?
Yes. So GT is a proud NCBT&B approved provider, but we do also recommend that you check out the GrastonTechnique.com for your state. You can also contact any type of board of state wherever you're from just to make sure as well. We do recommend that. When it comes to CEU, with the M1, which is the basic training, that's 12 CEUs. And then when you are finished with that one, you can take the M2, and that is 14 CEUs.
Very nice. And then you kind of told us a little bit about what exactly got you into the Graston Technique. Mm-hmm. So can you kind of, I have a general idea of what it is, but could you just give us a real good definition and explanation of what the Graston Technique is to you and define?
Sure. Yeah. So basically what the Graston Technique is, it's an evidence-based instrument assisted soft tissue mobilization. And that enables clinicians to effectively and efficiently address soft tissue lesions and fascial restrictions, resulting in improved patient outcomes, basically. The M1 course, basically, they will do establishing like guidelines for the GT and basic framework for static strokes and those type of applications, and they also teach you how to apply them to the full spectrum of the musculoskeletal treatment approaches. M2, they add about 5 new different types of strokes, but they also introduce mobilization. So you can stretch out people.
Okay. And so kind of how do you feel when you're practicing it? What kind of results have you noticed, or what do you feel like it's done for you as a practitioner to practice the Graston Technique?
So what I have noticed, the basic protocol of the Graston technique, and you do your assessment just like you would do a massage. Then you warm up the tissue. So whether you use your hands, whether you use bamboo, hot stone, whatever you want to do, you warm it up, and then you implement and incorporate the Graston instruments. And then after you implement it, then you stretch them out. So you can stretch out whatever it is you worked on. You can even make them go exercise if you had wanted to. And then you reassess. So it is very natural for me to incorporate the instruments, and then they can go about their day when the session's done.
Do you have any instruments?
I do have instruments, actually.
Do you want to show us?
Yeah. So this,
wow.
Yeah, this is the 6-piece set. They
Very
are
nice.
in a 3, but yeah, this is my set.
Very cool.
Yeah, come in all different sizes.
Oh, that's awesome.
Yeah, so you can work.
I might have to get myself some Graston tools.
Yeah, so you work everything from the larger muscle tissues to even all the way down to the condyles. If you have something like a epicondylitis, tendinosis, I mean, you can do just about anything with them.
And how do you notice your clients benefiting from this? What are some things you notice right away since you've been doing the Graston technique?
Yeah, I have noticed right away. Usually when it comes to Graston, you only need about 10 minutes if you're going to be working on something, and people notice it right away. I do have one client who has plantar fasciitis, and she was seeing a PT for it. In one session with me, she felt 85% better with her results than she ever did with her PT.
Oh, okay, cool. That's awesome.
Yeah, so when it comes to the Graston, you're warming everything up, and they can immediately go back about their day. They can jump back into a game or whatever they have to do, and they can continue their lives, but everything is warmed up and loose and ready to go.
Okay, so we talked about this a little, and you helped me with the pronunciation. Gua sha.
Gua sha. Yes.
Gua sha. Gua sha. I actually took a class in that, and I love it. And I do it a lot on my face. I'll do it on my legs, and if I'm not feeling good, I'll do almost my whole body.
Awesome.
So for me, it's been very helpful. And what I learned in that class was, a lot of people keep those tools in their home in different areas of the world. So I know when I've gotten those techniques or given them, you tend to leave marks on people. With the Graston technique, do you also sometimes leave marks? Is it painful? And how would you describe the differences between the two? I mean, that was a lot of questions, all in one big question.
No, that's okay.
That was a lot. All right.
It's okay. So basically, there's a huge difference between the two. When you're doing Graston, it's a soft tissue mobilization, and the instruments are so neat. You can dig into the muscle fibers, but you can also get to the tendons. So it goes a little bit deeper. And again, it warms everything up. Some people can have a little bit of a redness depending on their skin because everyone's different, but it is not like gua sha. Gua sha, it is completely different in that it is a ancient Chinese modality, and basically there's no scientific proof that it actually benefits the body, other than the fact that it is purposely causing the petechiae to rupture, which is small capillary rupture, right? So it's purposely causing that petechiae in theory that it's going to increase the energy and the flow of the body. So even going back to the mentality, it's not as scientific because it's more of the Chinese medicinal going and referring to energy and flow. Graston is a complete opposite with that. So no, Graston does not hurt by any means, and it only takes about 10 minutes to work on one specific area.
Okay, because I know that was one of the questions on the page was the differences. So one seems like more of a more ancient modality, and the Graston technique seems a little more maybe scientifically proven or more modern, and maybe the tools are a little more modern. I guess it just depends on what the client's looking for and what someone's drawn to. Exactly. It sounds like both would be great.
Yeah, exactly. It just really depends on what it is that you're going for. And GrastonTechnique.com on their website, they actually have quite a few other people who've done studies. So not just case studies, but also actual scientific studies with the Graston instruments. So it's really neat to read all the different articles.
I just, when we met and when you emailed me, I personally had no idea, none, that I could become, that I could learn the Graston technique. I had always seen chiropractors do it. I've heard of chiropractors do it.
Mm-hmm.
I've heard of PTs do it, but I am so excited that you helped. You literally helped all of us, walk through to help us to be
Yeah.
able to walk through a doorway to try the Graston technique.
Mm-hmm.
And I'm really thankful for that, and I hope everyone else is as well. I mean, Elizabeth, that's an absolutely amazing accomplishment.
Yeah.
Seriously, thank you
Thank
so
you.
much.
Oh my gosh.
And
Of course.
let's leave with one more. One more. Can you just give us a couple more examples of results that almost left you speechless with clients, or things that you find specifically that, like there's certain, we use, I think, certain techniques for different things. If someone came into you, what are certain things that you might use the Graston technique for?
So, I mean, you can do it just about anything. You have all types of things like tendinopathy issues, fascial syndromes, any type of ligament pain, scar tissue. You can do just about anything and everything when it comes with the Graston. Of course, it has this basic list of contraindications, just kind of like massage as well. Of course, you're not going to put Graston on an open wound, right?
Right.
Or Graston on pregnant women isn't encouraged either. But of course, just like anything else, we request that you see a physician for approval. Some of my success stories, the lady with the plantar fasciitis, that is probably my most favorite because it's dear to my heart, and the fact that I love a good compliment, and I was so amazed that one session and she was 85% improved. But I've had a picture before who was retired. He had, I think, 2 surgeries on his rotator cuff, and that create a lot of scar tissue work, and it would create a lot of restrictions with his range of motion. And immediately I just dug right in with the Graston instruments, and one session later, I mean, it's amazing on how well he was able to improve. I still see him to this day, and every time he'll alternate depending on his schedule, if he wants Graston or if he wants cupped. Graston and cupping, they're 2 completely different things. Graston as mission keeps everything warm. Cupping is a recovery. So if you're going to rest the rest of the day, then maybe I'll throw the cups on you too. It just kind of depends, but I don't usually do them both together. But the picture, that was a really cool story. I also had one lady who, she had what she thought was carpal tunnel, and they cut their tendon sheath. Well, a couple years later, she's still having issues, and she didn't know what was going on. So immediately I'm like, all right, I want to look at your neck. I want to look at your anterior middle scalene, and then I'm going to work all the way down your arm. So I did a little bit of a massage first as an assessment, and then I used the instruments, the GT6 primarily. That was the smaller.
The GT6.
GT6. So if you're looking at the instruments here again, it's this small little guy right there.
Nice.
That end has a little swivel, and I got on there and I just immediately started working her condyles, and then I worked my way up. So I worked her epi and lateral, and then I went all the way up to her neck using another instrument that we have. And again, one session. Amazing. That's all it took. I know.
I think there's just certain things that, I've always been old school where I need my hands. I have to have my hands, but I'm guessing that those tools, there's just certain things that they can do that my hands just are unable to do, and reach places and do things that the human hand just really can't.
Yeah, I mean, like I said, you can even get down to the tendon too, and not painful. I can do what's called a feather stroke, and it's a really light stroke, and immediately they would see the results. So it is, you're right, it's really neat. And of course that enhances the longevity of our career too, right?
Elizabeth, thank you so much.
Absolutely.
For everything you're doing. You are a massage superstar. We're so excited to get to talk to you, and I really, really, really hope that you come back and talk to me again, because as we were getting ready before we went live, we have so much to cover.
Oh gosh,
you got to come back.
So even if it's about multiple sclerosis or whether it's about any other modalities, I am happy to talk.
It's absolutely amazing, all the stuff you've done, and like I said, we'll look forward to having you back. So awesome. We'll be in touch.
Cool. Well, thank you.
Great job.
Thank you.
Okay, everybody, have a great day. We're signing off, and we are going to do some, we're going to talk to an owner of a float spa. So if you want to learn about floating, we're going to do that on Saturday. Have a wonderful day. Thanks again, Elizabeth. You're awesome.
Thank you. Thank you. Bye.